Hello and welcome to Language World Services training on challenges in mental health interpreting. My name is Megan and I work in the Quality Assurance Department here at Language World Services, and we're so happy you're joining us online to view this training on mental health interpreting. Some people might ask the question, why is there a need for a specific set of protocol or training on situations that involve mental health for the interpreter's field? And the short answer to that question is that 1 in 4 people living in this country are diagnosed with a mental health condition every single year. And the primary way of diagnosing those conditions is through talk therapy or through spoken word. There's no EKG or there's no definitive blood test to diagnose these conditions. So we rely very heavily on what's being said in each session. And that complicates things for the interpreter. It factors in things like emotion and the nuances of the language. And so today we're going to talk about all the ways you can best prepare yourself for these scenarios. There's a lot of different things you can do before your first appointment ever happens. And we're going to talk about all of those things today. If you have any additional questions after you view all of the modules today, please feel free to utilize the Email My Professor link that's in the sidebar of Digital Chalk. It's a great way to continue the conversation about the material that you're viewing today and to ask us any additional questions you may have about the content. Those emails go directly to the Quality Assurance Department, and we would love to help you with anything else that you'd like clarification on. So we are ready to get started on our training for challenges in mental health interpreting. And today your trainer will be QA resident Monica Tomasini. She'll be giving us all the information we need on mental health scenarios. Hey, Monica.
Hi, Megan. Thank you so much for the introduction, and I really hope you guys enjoyed this training. Thank you so much for watching it, and I really hope I can help you better get prepared for the mental health 101, the challenges that we'll be encountering in the field. So we have some objectives that we're gonna be exploring, and they are mental health scenarios, protocols and code of ethics, required interpreting skills, factors in speech patterns and communication, mental health stigmas, cultural conflicts, and interpreter safety. Okay? So since we have that in mind, we're going to start with our training. What is mental health? Mental health refers to a wide range of disorders that affect mood, thinking, and behavior. Mental health appointments can include treatment for depression, anxiety disorders, schizophrenia, eating disorders, addictive behaviors, and a number of other mental conditions. We have some common interpreting assignments. There will be one-on-one therapeutic appointments, family counseling, pediatric psychiatry, autism clinic, group sessions, clinical psychiatry, intensive outpatient programs, home visits, investigations, interviews, and assessments. So let's keep in mind that for all of these assignments, you will be interpreting for one patient only. That's our training will be focused towards. So keep that in mind, only one patient for each of these assignments. So let's see what we have here. First of all, when interpreting for mental health assignments, remember the code of ethics. That's just the basic that we have to start with right now. Let's go back to our first class and think about it. The code of ethics, what the interpreter should be doing. Facilitate communication between patient and provider. You were there to be a voice, and you were there to give this patient a voice, to be able to give this patient the chance to communicate what's wrong with him or her. You maintain confidentiality. That's very important as an interpreter as well. When you maintain confidentiality, you also give the patient that confidence that he can trust you to go on with the assignment. You remain impartial. As much as we sometimes want to step out of our role as interpreter because maybe we don't feel as comfortable with the situation, or maybe we feel that the patient might be going through something else that we definitely want to help, or maybe we went through that ourselves already and we have another vision about that. please let's keep in mind that we'll have to be impartial. Everyone is different, and we don't know the history of this patient as well. So we're gonna keep impartial. Not only we're gonna keep impartial with our words, but also we're gonna keep impartial with our body language and with our tone of voice. Be accurate. There's a huge difference between the word molest and rape. And for some types of assignments, and I would say for all types of assignments, this be accurate is very important. So you being accurate means you will interpret everything that is said the way it's said. You also will not change words that have heavily meaning on it, just like molest or rape. That will be very different. And I understand that sometimes we feel a little uncomfortable with a couple of things that are said in the appointment, but we definitely need to be accurate and just keep going. Make sure that this is going to be said the way you were supposed to. For interpreting skills, when we are rendering a faithful message, I would say that there are two components to successful mental health interpreting. And we're going to see them right now. It's linguistic depth and emotional depth. So linguistic depth, it refers to the language skills of the interpreter. For example, if the interpreter uses the same term for suicidal thoughts and suicide, that will be incorrect. So how to fix that? What is the appropriate course of action to take? That will be ask for clarification to properly define each term. So you ask for clarification either for the provider or either for the patient, and then you can move on with your interpretation as accurate as possible. The maturity, experience, and overall ability of the interpreter to handle intense or unpleasant situations. For example, the interpreter does not feel comfortable interpreting details of a rape or molestation, which is understandable. But the thing that I want you guys keep in mind is that since day one, we were taught to keep that poker face and leave our feelings behind when we are interpreting. Paying attention on the words, being able to render an accurate message, and then later in the day we'll think about how we felt about it, but not at the exactly moment. Now, it is much easier when we are interpreting because we are just paying attention on the words and trying in our mind find the best interpretation possible. So sometimes the details, they don't come across as strong as if we're just listening to it. Even though if it's affecting you, then I would will give you a suggested solution here, how to be able to handle that emotional depth. And the best thing to do is be honest with yourself and withdraw from the assignment or ask to be blocked. If you feel like you cannot do it, then it's too hard, you cannot do it, and then you ask to be blocked, you ask not to go interpreting this type of assignments anymore, and you can maybe specialize in other type of assignment. It's okay. What we definitely want to do is respect you and respect your opinions and make sure that you are comfortable every time you go interpret. So the role challenges that we have, that is also part of our code of ethics, that yes, we are expected to follow that, but we have these role challenges that will be, oh, I'm going to step outside of my professional role and try to help the patient. Just like in the example here, the interpreter feels compelled to advocate for the patient. Well, first of all, remember that language role that we don't advocate for the patient. And second of all, advocate is something that should be done only for the more experienced interpreters. And when they feel like they are very strong about their idea or their suggestion, how to advocate and how I'm gonna advocate. I'll give you a suggested solution when this happens. Set boundaries. Be nice, but explain your role to the patient and never stay with the patient alone in the room. Remain impartial. Employ the say no model. Be gracious, say no gracefully, you offer choices, and you give reasons why you cannot do that.
Next up, we're going to watch a video on challenges in thought process. How do we interpret when a speech is long and rambles and doesn't make sense? Watch the following video and determine how you would interpret in this situation.
The third type of symptom that may be present is disorganization of thought and speech.
So that the thoughts are disconnected, and when a person speaks, there's either a great deal of tangential, circumstantial, rambling kinds of lack of connectedness of one thought to the other.
Like in the daytime, when I be outside in the sun, I used to show my friends things that they hadn't seen before, like the halo. See, like the halo, when I was 19, when I was a preacher, and I had my trial sermon, I used to see a little light over my shadow on the ground in the daytime. And then now, ever since then, it's like a light coming further down over my body, around my shadow. It's over my body, but around my shadow, and I see the light, which is your halo, I mean your aura. And that's why everybody can't see that. But if you see, you got something to do with the drugs too, we say. And now I don't know what's for real. I know what I see, but I don't know if it's for real or not. And so that's why you say people are different. And see, like that anointing, like see, like sometimes when I come outside, I can see when I look at the trees, the wind starts blowing. Cause we know we get oxygen from the plants, and we get them carbon dioxide. And so it's the wind usually blows sometimes, but it don't blow all the time. Like when I'm in the house a long time, it blows real strong.
How would you interpret in that situation? Well, we have a suggested solution. You avoid trying to make sense out of the patient's answers or to construct meaning. The interpreter should do their best to render an accurate interpretation of what has been said. This may include rambling and incoherent speech. So the challenge that we have also that we might see in the field will be dysfluency. A speech dysfluency impairs the ability to produce smooth, fluent speech. Like, let's see a couple of examples. Breaks, when we have a lack of fluidity, hesitation, irregularities, unusual, dysfunctional word choices, false starts, words and sentences are cut off mid-utterance, phrases that are restarted or repeated, hedges, well, so, etc. Repaired utterances. Speaker corrects their own mispronunciation. It is the job of the interpreter to provide as accurate rendition as possible, because these dysfluent patterns of speech can provide necessary information for diagnosis and treatment of the patient. The interpreter must do their best to convey the message clearly. Again, as interpreters, we want to make sense out of things. We want to make sure that we're interpreting meaning and not only words that we throw in there. But in the case of the dysfluency, the same way as the other slide that we saw, that we have a speech that is long and doesn't make sense, we need to forget about making sense out of the things that the patient is saying and really convey whatever was said. So this can give the psychologist or the psychiatrist a better idea of his or her problem.
How about a challenge scenario of a stuttering patient? Watch the following video and determine how you would interpret the speech of the young patient in this video.
Have you ever had a dream that you want him to do you so much you could do anything?
So how would you interpret that? You interpret the message as the patient has spoken it. You include stuttering and false starts. I know it's hard, so that's why we want to prepare you to be ready in case of that situation arises. So we have another scenario, another challenge scenario, when the patient is repeating the same phrases over and over and it is not being responsive to the questions of the specialist. It kind of goes into our mind that maybe the patient is not understanding, but we are sure that we are interpreting exactly what the psychiatrist or what the psychologist is saying. So what is the suggested action here? The interpreter should continue interpreting the message as is being uttered to allow to the therapist to observe the patient's speech patterns and behavior. So not as much as what the patient is saying, but the fact that the patient is repeating the same thing over and over again. Watch for your body language in that situations. Some people tend to roll their eyes. So we have another challenge scenario where the patient is repeating the same phrases over and over. They're not allowing pauses or breaks for interpretation. Well, I want to remind the interpreters also that in a mental health setting, the best thing to do is don't ask for pauses. Is right away switch to simultaneous interpreting and convey the message of the patient as faithfully as possible. Because in this case, the psychiatrist is also noticing that the patient is speaking non-stop. If you stop, it will just cut the patient and maybe don't give the best idea for the psychiatrist.
With the challenge of vocal inflections, the patient's voice and how they're saying the words factor heavily into the provider's diagnosis. So in the case of interpreting, the way that they're saying it, in addition to the words that they're saying, are a very big component to the diagnosis and the treatment plan that's created for the patient. So things like intonation. Are they speaking in a monotone way? Are they speaking in an agitated way? Are they angry? Are they sad? Are they low energy? All of those things are things that you need to convey in tone to the provider so they can factor those into their diagnosis. Are they speaking at a high volume? Are they speaking at a low volume? You need to mimic the volume of the patient so that the provider knows how they're saying things and exactly when they're saying them. Emphasis. If they're choosing a specific word and really hitting that very strongly when they're emphasizing their words. Maybe they're saying mother in an angry way. Maybe they're saying hurt. Whatever word they're emphasizing, you have to repeat your emphasis when you're providing your interpretation. Also, the pace of the interpretation factors heavily into the diagnosis. Are they speaking slowly, in a stunted way? Are they speaking in a manic way? All of those things are clinically relevant, so you have to replicate them when you're providing your interpretation.
Now, let me give you a critical thinking question. How do you think inflection could affect meaning? There's a huge difference when you say, I'm fine with it. Or, yeah, I'm fine. Or, oh no, I hate this so much. I hate this. That will be totally different the way that we're going to be interpreting, and that's why the vocal inflections are important. That's the second question there. Should interpreters mimic the patient? For all the vocal inflections, yes, that's part of our protocol. We're going to match the tone, we're going to match the volume, we're going to match the emphasis, we're going to match the pace. Now, if I ask you, should we mimic the gestures, then I will say no. Why you should not be mimicking the gestures will be because the patient is supposed to be having eye contact with the provider, or the provider also is supposed to be having eye contact with the patient. So interpreting will just be the voice.
The interpreter might face the challenge of not wanting to repeat the words that the patient is saying, whether it's foul language or aggressive language or something that they don't fully understand. There's a large temptation to censor or filter what the patient is saying. Maybe you don't want to say the bad word back to the provider. Well, in mental health scenarios, you absolutely have to mimic what the patient is saying back to the provider. It could factor into the diagnosis of the patient. So you have to suppress that temptation to censor or filter what the patient is saying. Everything that's being described in that room, even if it's not comfortable to repeat it, is something that the doctor needs to hear, and you need to do your best to interpret it in each situation.
I know that several people have a problem with these curse words, but as an interpreter, you know that you should be interpreting everything the way it's supposed to be. The suggestion, all foul language should be interpreted to the best of the interpreter's ability. Refrain from filtering or censoring the patient's words. And we know that we tend to go a little lighter. And it's important to keep the same what the patient is saying. I know that we don't have exactly match word for each foul word that we have in English, but again, it says right there, should be interpreted to the best of the interpreter's ability.
When you begin interpreting in a mental health setting, you need to be conscious of the fact that there might be a stigma associated with the mental health appointment. You have to check all of your previous opinions at the door and remain neutral and impartial when you go to interpret for these patients. And you also have to factor in that culturally, there might be different stigmas associated with that patient receiving care. So the key to mental health interpreting is complete neutrality. You're going to be there, you're going to be impartial, you're going to convey the message between both parties without judgment or without anything else on the table. And keep in mind that the families of the patient, even the provider at times, will have their own personal opinion, their own judgments, their own cultural ramifications for things. Your job is to convey the language and to provide language access, not to have an opinion either way. In terms of interpreter safety, there's some different ways that you can maximize your safety in every potential situation that might come up. And the first way you can do that is to stay true to your positioning. Stay as close to the provider as you can. Take your physical cues from them as to how to behave in each situation. They know the patient, they know the patient's history, they've been clinically trained on how to behave in these situations. So mirror how they act and what they do in order to maximize your safety. Another concept to keep in mind, which is very important because it builds trust between you and your patient, and it also keeps everything relaxed, is neutrality. Keep your face and your body language neutral and relaxed. Don't try to react physically or facially to what you're hearing. Even though sometimes the subject matter can be disturbing, it can render an emotion, whether positive or negative. You don't want to have a reaction to what's being said in the room. It makes the patient feel like they need to minimize what they're saying. It makes them feel judged. And we want to stay as neutral as possible to create a safe environment. The third option for that to maximize safety is to have an exit strategy in mind. Take every scenario and plan for it like the worst case scenario might take place. So after you enter the room, create an efficient exit strategy. If everything goes crazy, how are we going to get out of the situation? If things get heated, if things get physical, you need to know how you're going to be leaving that room because your safety is always your first priority in these situations.
A couple of factors that we need to keep in mind. Personal space. Mental health patients may not recognize the need for personal space. Don't take it personal. Verbal outbursts. A patient may become agitated, scream, curse, or have a variety of other verbal outbursts. Physical outbursts. Spitting, shoving, pushing, and scratching are all examples of physical outbursts. Something that I want to keep in mind is that what it became as a verbal outburst can turn into a physical outburst as well.
So we've talked a lot about the challenges that an interpreter faces when interpreting in mental health scenarios. So now I want to talk about the reasons why anybody would want to do this professionally. And there are a lot of reasons. The first of which being that you're paid more to interpret for mental health scenarios. There's a higher volume of appointments that are available to you if you have these skills ready to go. So that's one reason. Another reason is the idea of contributing and giving back. These people are people that are being misunderstood, not just from a language access perspective, but because they're not sure what's going on and they don't feel right and they need help understanding what's going on with their mental health. So you're bridging that gap between patient and provider and you're contributing directly to their personal health. Another reason to interpret for mental health is because you're giving back to your community, you're contributing, and you're helping people in your culture, in your community, understand what's going on. It's a very rewarding thing to do, to directly impact your culture and community directly. The final reason is professional growth and challenge. This is the ultimate interpreting challenge because there's so many things that can come up. You have to be a strong simultaneous interpreter, and you have to be adaptive enough to respond to a series of different scenarios in the field, whether it's with young children with autism or elderly patients with dementia. You have to be flexible in each situation and know how to handle them. So it's a very big challenge professionally that you might want to see if you're ready for. And all of those things combined can be a very rewarding practice. You know that you're giving back, you know that you're earning more money for what you're doing, and you know that you're at the height of your skills in terms of mental health and medical interpreting. Thank you so much for joining us today for Monica's training on challenges in mental health interpreting. I know we all learned a lot about what to expect out in the field, how to work on our protocol, how to work on our medical terminology so we can be as best prepared as we can for mental health scenarios.
Thank you so much, and I hope you guys have enjoyed that training. And please feel free to contact us if you have any questions.
Thank you for learning with Language World, and we'll see you at the next training.